Hey guys, welcome back to my channel. I hope you all enjoyed the previous video and today our topic of discussion are the various stages of labor, right? But before getting into the topic, I would like to inform you all that at the end of this video, I would be putting up some questions which would be comprising questions from this as well as my previous video. So if you all haven't watched it, you all can just have a look at it. And I am doing this because I believe that the understanding is incomplete until you answer some questions from the topic, right? So I'll be putting up some questions and you can let me know the answers in the comment box, right? So let's move ahead. Yes, let's get started. So what is labor? First of all, what is labor? Let us build our concept from this. So actually labor is a series of events that would take place to expel the fetus, the placenta and the membranes. As you know, in my previous video I had told you all that in fact I had explained placenta and the membrane formation. So along with the placenta and the membrane, yes, obviously the fetus has to come out. So in the various stages our effort would be understanding how to expel these products of conception out of the uterus, right? That is what is our aim. So let's get started, right? And also you'll need to keep in mind that there are 4 stages of labor in total and we'll talk about them one by one. So let's talk about the first stage of labor. Okay, now first of all let me give you all the definition of the first stage of labor. The first stage of labor is actually from the onset of the true labor pain up to the full dilatation of the cervix, right? Up to the full dilatation of the cervix. And also, when do we call a cervix fully dilated? We'll call it when the cervix is 10 centimeter, we'll call it fully dilated. So yes, from the onset of the true labor pain up to the full dilatation of the cervix is the first stage of labor, right? So the fetus is not expelled in the first stage, it is expelled in the second stage. But then why is the first stage occurring? The first stage is occurring to prepare the uterus to expel the fetus in the second stage, right? So we have to prepare, we have to do a preparation of the uterus. That is why the first stage of labor is occurring. So how will we prepare the uterus? So we will prepare the uterus by 3 ways. I have divided them into 3 ways. Those are, number 1 is the contractions of the uterus. The second thing is the fetal axis pressure, and the third thing would be the bag of membranes or the bag of waters, right? So let's look at them one by one. Number 1 is this process of contraction, second is the fetal axis pressure, and third is the bag of membranes. So we'll look at all of them with a video, right? We look at all of them with an image. So yes, let's move on. Yeah, so yes, if we look at this one, this image is before labor and this is after labor. This is the uterus of the mother and this is the cervix of the mother, right? Can you see that these muscle fibers of the uterus arranged in this pattern? This is what? These are the longitudinal muscle fibers of the uterus and these are the circular muscle fibers of the cervix, okay? So these longitudinal muscle fibers of the uterus are connected to the cervical fibers, which are actually the circular fibers, in a bucket handle fashion. Can you see? How is a bucket handle? Bucket handle is like this. So they are attached in a bucket handle fashion. So can you imagine that when these muscles, the longitudinal muscle fibers of the uterus are going to contract, they will contract and they will pull the cervix apart. Yes, they will pull the cervix apart. So when they do this, they will dilate the cervix, which is this process or this image, right? So this is one of the mechanisms, which is uterine contraction. So as the uterus contracts, it will pull apart the cervical fibers, right? But also remember one thing, that when the uterus contracts, the cervix has to relax, okay? Because if the cervix also contract, will it let itself open? No. So even cervix has to dilate when the uterus contracts. So this, coordination between the contraction of the uterus and the dilatation of the cervix is what is known as the polarity of the uterus. Okay? This is the polarity of the uterus. So this was number one mechanism, which was the uterine contraction. Next, we'll move on to the mechanism which is the fetal axis pressure. So, as you all would be knowing that the lie of the fetus is most commonly longitudinal, and the presentation of the fetus is most commonly a vertex presentation, which means that the fetus most commonly has the head below with the body somewhat like this, and these are the lower limbs of the baby and these are the upper limbs of the baby, if I draw it in this way. So did you notice that the buttocks of the baby are in contact with the fundus? And I had already told you that the fundus has the maximum contraction, right? Out of all the parts of the uterus, this fundal area contracts maximally. So when it contracts, it will transmit the pressure via the buttocks, the vertebral column or the spinal cord area. Then it will come to the fetus, and when it comes to the fetus, can you see that the fetus is lying exactly over the cervix? So this will again apply pressure and dilate the cervix. So this is another mechanism, which was the fetal axis pressure. And the third mechanism would be a bag of membranes. Now what do you mean by membranes? Membranes are the amnion and chorion that I had already told in the previous video, right? I had told the formation of those membranes. So these are the membranes, and the membranes contain what? They contain the amniotic fluid or the liquor amnii, right? They contain the liquor amnii or the amniotic fluid. So did you see that when the cervix is somewhat dilated, the fetal head will come into contact with the maternal pelvis? They will come into contact with the maternal pelvis, right? So this point of contact of the fetal head with the maternal pelvis is known as the girdle of contact. So actually, when the baby is lying over here, because of the gravitational pull, some amount of water would slide down and it would come down, okay? So I have divided this water again into two parts. Can you see that the one which is lying below is what? It is the fore waters, and the one which is lying above is the hind waters, okay? So this is what I formed. So with the bag of membranes also, it is applying a pressure and my cervix is dilating. This is the third mechanism. Now a somewhat deviation from the normal that I would like you all to know is, suppose, imagine a situation when the fetal head does not lie in contact with the maternal pelvis. It is not properly in contact. Then can you see that it has left some area over here? Then instead of the normal amount of water which comes down, a lot of water will come down. It will form a bulge over here. So this might lead to an early rupture of membrane, right? The membranes are not supposed to rupture right now in the normal labor mechanism, right? But if this mechanism happens, then it might rupture early, okay? Let's move ahead. So we have talked about the contractions, the fetal axis pressure, and the bag of membranes, right? We had talked about this, and let me tell you all that this entire thing, all of these were leading to what? they were leading to a dilatation of the cervix. They were leading to a dilatation of the cervix. So this is the number one thing that occurred in the first stage, that is the cervix dilated in order to expel the fetus in the next stage. Second thing that would happen is, in the first stage itself, is the effacement. Now what do I mean by effacement? Effacement means thinning out, right? The cervix has to thin out in order for the baby to pass. So only one piece of information that I would like you all to know about effacement is this, that I would like you all to know is that when the effacement, this diagram, is occurring in a primigravida, and this diagram occurs in a multigravida, or primigravida is also a nulliparous woman. Okay, so in a nulliparous woman, what happens is that the effacement, that is the thinning out of the cervix, can you see the cervix is thinning out, the cervix is thinning out and merging into the uterus. This is occurring before the cervix dilates. The effacement is occurring before the dilatation of the cervix, whereas in a multigravida both the process occur simultaneously. This is just one thing that I would like you all to know about the effacement process. And then I had told you about dilatation, I had told you about the effacement, and the third thing that will occur in the first stage of labor itself is the formation of the lower segment of the uterus. Okay, before forming the lower segment, I would like you all like to tell you all the normal anatomy of the uterus. Okay, so if you look at the normal anatomy, this is the body of the uterus, right? This is the isthmus and this is the cervix, and this is the fundal area where I told you that the contractions are the maximum. Okay, now see, if you look at this isthmus area, isthmus is the constriction after which the cervix will begin. So isthmus is bounded above by the anatomical internal os and below by the histological internal os. So this area of isthmus in a non-pregnant woman, mind you, in a non-pregnant woman will correspond to what? This will correspond to the lower segment in a pregnant woman. Okay, this will correspond to the lower segment in a pregnant woman. Okay, so what happens in a pregnant woman is, corresponding to the above boundary anatomical internal os, there would be formation of a physiological retraction ring, and corresponding to this histological internal os, there would be a formation of a fibromuscular junction. Okay, fibromuscular junction. So this will convert into what? This will convert into the lower segment. So if we move on and see this thing in the pregnant woman, see, look at this area. This was the anatomical internal os which had converted into the physiological retraction ring, and this was the histological internal os that has converted into my fibromuscular area. And what do I call this? I call it the lower segment of the uterus, right? Now, did you see that with the formation of the lower segment, I have divided the uterus into an active segment and a passive segment. Why am I calling this segment as active, the above segment? Because this is the portion which will keep on generating those contractions, and the lower segment will do what? The lower segment will efface out. And I would like to tell you all that when we perform a cesarean section, which we call LSCS, the lower segment cesarean section, we give an incision over this segment. Okay, right, now let's move on. So this was the first stage of labor. We have completed the first stage of labor, right, which was dilatation of the cervix, the effacement, and the third thing that I told you was the formation of the lower segment. So yes, my uterus is now fully prepared to deliver the baby out. Okay, and what did I tell you about the first stage? The first stage was from the onset of the labor pain to the full dilatation of the cervix. Also, this is lasting somewhat 12 hours in a primigravida, okay, and somewhat 6 hours in a multigravida. Okay, yes. So full dilatation of the cervix. Now I would like to know, I'd like you all to know that this dilatation of the cervix will occur, and then only the membranes would rupture. Okay, after the cervix is fully dilated, the membranes would rupture. If by chance these membrane rupture before the dilatation of the cervix, then what would I call it? I would call it an early rupture. Early rupture if it occurs before the dilatation of the cervix, but after the onset of labor. The labor has started, but the cervix is not fully dilated and my membrane rupture, then I would call it an early rupture. But if they rupture even before the onset of labor, then I would call it a premature rupture. Okay, so these are two terminologies that you need to be careful about. Okay, so I have completed successfully my first stage of labor. Then I would move on to the second stage of labor. What would I do in the second stage of labor? Second stage of labor is the actual one, which is lasting from the full dilatation of the cervix. Yes, the cervix has fully dilated now up to the expulsion of the fetus. Okay, now this stage is occurring because of these contractions that I talked about. You need to understand that these contractions, will gradually go on increasing in intensity, and they will become much more frequent. Okay, if they were occurring at say half an hour interval, they'll now start occurring at 10-hour interval, for 10 minutes interval, for example. Okay, so yes, and this will cause the expulsion of the fetus. Then I'll move on, and second stage of labor is lasting average on an average duration 2 hours in a primigravida and for 30 minutes in a multigravida. Okay, now we move on to a third stage of labor. What will happen in the third stage of labor? See, I have expelled the fetus in the second stage itself. What am I left with? I am left with the placenta and the membrane, which I talked about in my previous video. Placenta plus the membrane, so they would be expelled in the third stage of labor. Now here I would like to emphasize about how the placenta would be expelled, right? Because placenta has to separate from the uterus. Okay, so let's see. Let's look at another diagram over here. Yes, this is, yes. So with the expulsion of the fetus, what happens is the uterus somewhat contracts. Okay, so the uterus, this was the placental surface area earlier, but then after the expulsion of the fetus, can you see that the uterus has contracted and now the placental surface area has become short? So this is one of the driving forces why my placenta would separate. But then I would talk about what are the how actually it would separate. Okay, so I have two mechanisms of separation of the placenta. I have two mechanisms. One would be a central method of separation. This is the Schultz method of separation, and this is a peripheral method of separation. This is known as the Matthew Duncan method of separation. Right, these are the two mechanisms of separation of the placenta. In this mechanism, what happens is the placenta separates centrally. So the placenta would come out first, and then the blood would come out. And then in the Matthew Duncan, what happens is it starts to separate marginally. Okay, so the blood would come out first and then the placenta would come out. So this is the third stage of labor, where the placenta and the membranes would come out. And lastly, what is the fourth stage of labor? What is the fourth stage of labor? the fourth stage of labor is, and remember that the third stage for multi as well as primary gravida on an average lasts for 15 minutes only, right? And what is the fourth stage? The fourth stage is basically nothing. You are trying to observe the woman for any complications that might occur. And you would observe her for at least 1 hour. Observe her for at least 1 hour because you don't want any complications to occur. And also remember that after the placenta and the membranes have come out, after they've shed off, what will happen is the uterus is a living ligature. What it will do is it will itself contract. If these are the uterine muscles, they will shorten, they will contract. Okay, the uterine muscles, they have a property of retraction. Retraction means permanent shortening. So they would contract, and in between they have some arteries going like this. So when they contract, they will compress the arteries, and that is why we call them as a living ligature. Okay, we call them as a living ligature. Okay, so this will reduce the bleeding. This will reduce the amount of bleeding if they contract the vessels. So this is very much required. Okay, this is the principal mechanism of achieving hemostasis after the woman has delivered. Okay, so we have completed the 4 stages of labor, right? And apart from this, I would want to tell you all that how clinically would you assess these contractions and all. See, for contractions, in short, I would tell you is that for knowing the contractions, you just place your hand on the fundus of the uterus of the woman. Okay, just place your hand on the fundus, and at the height of the contraction, you try to indent, or you try to move your hand inside. Okay, try to indent the uterus. If at the height of contraction you are unable to indent, means what? Means that the contractions are good. Okay, and second, if she's in a true labor, then she'll have pain as well, and then her cervix will go on dilating. How would you assess the dilatation? So dilatation and effacement, remember, both are assessed by a per vaginal examination. The contractions you had seen by per abdominal examination. So dilatation, how would you check for it? You would place your finger into the external os of the woman. If this is the cervix, okay, this is the cervix, it has got an internal os and it has got an external os. Just place your finger in the external os and see how much of your finger can you insert. Remember that one finger on an average is approximately 1.6 centimeter. So you just insert your finger and see that how much of the cervix has dilated. Okay, and how would you check for effacement? Effacement, once again, you would check per vaginally. You would check it by the length. Okay, you would check it by the length of the cervix. Now remember that cervix has got 2 portions. Okay, cervix has got 2 portions, as I had shown you in this diagram, that the cervix anatomically has got 2 portions. It is projecting into the vagina. Okay, so this is the supravaginal part of the cervix, yes, and this is the vaginal part of the cervix. So for checking the effacement, you have to see how much is the length of the vaginal part of the cervix. Okay, and then you have to express it in terms of percentage, like 50% or 100%, right? So that is how you would check for these signs clinically. And then remember that after you've checked for dilatation, you would mark it on a thing which is known as a partograph. This is what? This is a partograph. Remember, this is not the entire partograph. I am showing you only one portion of the partograph where you would mark the dilatation of the cervix. Okay, also keep this in mind. In the first stage of the labor, what do I have? I have 2 phases. One is the latent phase and the other is the active phase. So what happens in the latent phase, my cervix dilates only from 0 to 4 centimeter, and in the active phase my cervix dilates from 4 centimeter to 10 centimeter. So remember, you will start plotting on the partograph only when the woman is in the active phase of the first stage of the labor, not in the latent stage, right? So if you would see, this is the partograph where I have the dilatation in centimeters of the cervix on my y-axis, and on the x-axis I have the time. Okay, so whenever she comes to you, what you would do is you would mark it on the partograph. Suppose she has come to you and she has a 6 centimeter dilatation of a cervix. You plot 6 centimeter on the alert line. There are two lines, alert line and action line of the partograph. You plot 6 centimeter on the alert line, right? And then you will keep on plotting. Okay, so if the suppose the graph is on the alert line, it is to the left of the alert line, which means that her progression of the labor is normal. If it is to the right, which means the progression is slow. Okay, the dilatation is not occurring up to the mark. And if it's on the action line, then if it has reached the action line, then you have to take some action. You have to intervene in this patient because her dilatation is extremely slow. Okay, so that is all about the stages of labor and how you would clinically assess. Okay, and as promised, I would be putting up some questions in the comment box, and I would like you all to answer in that comment. Okay, and also let me know how you liked it and what is the next topic that you would like to see. And yes, do like, comment, share and subscribe, right? Thank you so much for your patient listening.